March is Colon Cancer Awareness Month. It's the second leading cause of cancer deaths in the United States that affects both men and women, and it's preventable.
Yep.
Here to talk more about this subject is Dr. Paula Walker-King. So nice to have you here.
Great to be here, Cheryl.
Yes. So first, let's start off with how many people are affected by this disease?
Well, about 140,000 people in the United States are diagnosed with colorectal cancer, and about 50,000 of those people die. The tragedy is that this is totally a preventable cancer.
Preventable. Okay, so
Yes.
what are the symptoms?
Well, the symptoms, typically, when these precancerous polyps develop, there are no symptoms. But as the disease progresses, people will notice blood on the stool. They'll notice abdominal pain that persists. They may even begin to lose weight, and they really can't explain why they're not making any extra effort to diet or lose or shed the pounds.
Okay.
Yeah.
So who's at risk for this?
This is a disease that increases with advancing age. So the older you are, the greater your chances of developing colon cancer. So over the age of 50, once we hit 50, we need to begin screening. And that really is the point of power with this particular disease. When we screen, we can identify cancer of the colon early and, have the best possible outcomes of completely curing it.
Okay, so when we talk about screening, we're talking about a colonoscopy.
A colonoscopy.
Okay,
right.
and it starts down here.
Right, and so it's basically it's a little tube. We call it a colonoscope, and it's got a camera on the end as well as a light, and it goes in through the rectum. So this is the rectum. This whole thing represents the digestive tract. Once it goes in through the rectum, the doctor is able to visualize the inside of the colon, right, which is outlined here in gray, right? But we're mostly focusing on this portion of the colon, but he's able to look and see if there are any abnormal growths known as polyps, which are precancerous lesions. He'll
take those right off.
She or he will remove those.
Okay.
They can also take a biopsy of the tissue while they're there, and they can actually look to determine the health of the colon just with that one simple screening. If the colonoscopy is normal, then you're actually cleared for another 10 years.
10 years.
So it's not like a screening that has to be done annually or anything of that nature. So we have a picture on the screen there showing the inside of the colon and what that is.
Through the camera lens,
Through the camera lens.
Okay.
And so sedation is provided for this colonoscopy, and so people don't need to avoid having this simple screening test done because it really does save lives.
Okay, so we should start around the age of
50.
Around the age of 50, unless you have history in your family.
Unless there's a family history, and then we typically will screen sooner.
Screen sooner.
Yeah.
Okay, so you may want to just see your doctor and talk to your doctor about this.
That's right.
All right, thank you, Dr. Paula Walker-King.
You're welcome.
We're going to send it over to Elizabeth.